Hi, this is Dr. Singareddy from Empower Psychiatry and Sleep. Suicide is a major cause of death in individuals who struggle with psychiatric disorders, including depression, other mood disorders, as well as schizophrenia. Unfortunately, more than 40 to 50,000 deaths happen with suicide in US and more than 700,000 deaths happen worldwide as a result of suicide. Unfortunately, we do not have a good intervention or treatment yet for suicide and suicide prevention. A common standard of practice for somebody who is at heightened risk of suicide is admission to inpatient psychiatric hospitals. However, the evidence in terms of benefit with inpatient psychiatric hospitals is lacking. In fact, in some cases, the risk of suicide increases immediately after discharge from inpatient psychiatric hospitalization. Unfortunately, we do not have any other less restrictive intervention that is useful in that scenario. So it is not unusual to see that we continue to practice admitting individuals who are at heightened risk to inpatient psychiatric hospitalizations. There has been a recent systematic review pertaining to suicidal interventions that was published earlier this year in 2025. This included studies that were conducted from 2014 to 2024, and the authors summarized data pertaining to three medications that could likely benefit suicide. Among them, number one, lithium. Lithium seems to have the most robust data in terms of decreasing the suicide on the long run. Most of the studies pertaining to lithium were conducted in bipolar depression. There were few studies which were conducted in depression, and the levels of lithium were in the range of 0.6 to 0.8 in several of these studies. However, there were many studies where they did not report about levels of lithium. Number two, ketamine. IV ketamine seems to have significant benefit in terms of improving acute suicidal thoughts. However, the data pertaining to long-term benefit with ketamine is not there. It does not seem to improve long-term benefit in terms of suicide, but it does seem to be one of the medications that could likely improve suicidal thoughts immediate, and the response seems to be pretty quick, including as much as like within a couple of hours. Number three, clozapine or clozaril also seems to have significant benefit in terms of improving suicidal risk on long-term basis. Most of the studies pertaining to clozapine were done in individuals with schizophrenia or schizoaffective disorder. No matter what kind of intervention one chooses, there is substantial evidence that cognitive behavioral therapy targeting suicidal thoughts has significant benefit in terms of preventing suicide. No matter what medication intervention or other intervention is being tried, CBT should always be implemented in somebody who is going through or struggling through suicidal thoughts or is at heightened risk of suicide. Most importantly, it is essential to understand the individual's thoughts pertaining to his suicidal ideation. By that I mean understanding his reasoning, rationale as to why he wants to consider this is critical. The mere act of attempting to listen and understand somebody who is struggling with suicidal thoughts could itself be therapeutic for that person. Thank you very much. This is Dr. Singareddy from Empower Psychiatry and Sleep.